Hi, it's Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, checking in at where life becomes better living. Today's topic, we're going to talk about Parkinson's disease. Not only Parkinson's disease, but Parkinsonian's dysfunction. So any sort of shaky tremor type of disorder, post-stroke, any sort of neurodegenerative disease. But we can call it Parkinson's, or there's other similar type behaviors the body can suffer from. We reference in traditional Chinese medicine as a Parkinsonian's dysfunction. There was a study done and published in early 2021 on herbal medicines in managing stroke and neurodegenerative diseases. And there was a subsection of it of diseases and how Chinese herbal products were effective or not effective for non-motor symptoms of Parkinson's disease. This was done in Taiwan, a population-based study. A total of 9,117 patients were selected out of 1 million. So the results were such that were very encouraging to folks suffering from these types of symptomologies and issues that affiliate with PD, Parkinson's disease. The results were that traditional Chinese medicine users in the study, of the 9,117 patients that participated, the users that took the Chai Hu Long Gu Muli one, which was one of the most prevalent. Of course, it was based on the pattern differential per patient. That was the most commonly used, showed neuroprotective effects. So in 2000 to 2011, this study was done. And again, the 9,117 patients that were diagnosed with Parkinson's disease participated. Parkinson's formulas were used in Chinese medicine, such as Chai Hu Long Gu Muli Wan, Matsi Ren Wan. Those were the two most popular, and there were multiple others used depending on the patient's pattern differentiation. So if you have Parkinson's disease, you might strongly want to consider consulting and participating with a treatment plan that would include an acupuncture physician who's competent in Parkinson's, and an acupuncturist or a doctor of acupuncture and Oriental medicine. So in traditional Chinese medicine theory, otherwise known as TCM, PD or Parkinson's disease is characterized, as we know, by tremors or muscle rigidity, which are caused by, typically the pattern is Gan and Shan Yin deficiency. Chai Hu Jialongu Muli Wan is often the most commonly used formula, specifically when we're talking about patients with this degenerative disorder in Taiwan. So based on the syndrome, however, it's essential to articulate specifically per patient what their pattern differential is. So we call that syndrome differential. The most common TCM syndrome patterns of PD are Gan and Shan Yin deficiency. The second one would be like deficiency of qi and blood. And oftentimes, if you look at the CBC and metabolic panel of a PD patient, they do have low red blood cell count, hemoglobin, and often sometimes lower platelets, as well as sometimes they will have liver enzymes that are off. So in Chinese medicine, we look at it this way, but it's really the same if we translate it over to the CBC and the metabolic panel. So the number 3 pattern in traditional Chinese medicine for Parkinson's disease is phlegm, heat, and wind stirring. The 4th one would be blood stasis and wind stirring. And the 5th one would be qi and blood stagnation. So we're very scientifically specific in traditional Chinese medicine when evaluating, diagnosing, and treating a Parkinson's disease patient, because they are not all the same. So, to continue, in traditional Chinese medicine theory, PD is characterized, again, by, as we know, the shaking and the rigidity of the muscles. So typically and most commonly, it's caused by what we call as gan and shan yin deficiency, and could result in the malnourishment of the muscle, leading to what we call the gan qi deficiency, or stagnation, or the gan yang excessive, and then, of course, developing endogenous gan wind. So, how do we help? The best part of this particular study, and why I'm sharing this for my patients, is because a recent systematic review showed that several compounds had neuroprotective, neuroregenerative, and antioxidant properties that could reduce neuronal loss or neurodegeneration in PD models. So that's the great news, folks. I wish you all excellent success in your treatment of Parkinson's disease or any type of tremor or shaky disorder, because it is scientifically shown, although more research does need to continue to be done, there is factual evidence based on this study and the reviews that I've just stated that it can be useful in part of your optimal treatment plan. So buddy up to your acupuncture physician and your doctor of acupuncture and oriental medicine and seek additional treatment if you suffer from any type of Parkinson's disease or tremor disorder that I just discussed with you. Okay, hope it's helpful. I welcome your comments below. Make it a great day. Thanks for checking in with Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life does become better living. Jusque demain.